I haven't done any sitting stats in a while, so here are 4. 80% of people experience some form of back pain during their life. That makes it the #1 health problem in the world. The #1 cause of disease, disability, lost productivity, and lost days at work. And that's because 60 to 80% of that first 80% will have a relapse in their back pain within 2 years. And yet 90% of people don't know what causes their back pain. If 90% of people don't know what their back injury is from, what the hell's going on? A quick disclaimer before you start this video. I and we here at Core Advantage are not in the business of diagnosing injuries. We don't diagnose, we always refer it to clinicians, physiotherapists, and sports doctors. If you have some form of a back injury or a lower back complaint, or any injury for that matter, seek professional health advice. Don't listen to a video on YouTube. This is supposed to be educational, and hopefully by understanding what's going on in your body, you can get a better idea of what's going on with your injury and then better manage it in the future. But please, if you've got an issue, if you've got an injury, seek medical advice. It's not a good whiteboard session, the pen's dead already. That's better. Okay, so with the back, let's talk about the actual mechanical things going on. The first type of injury you can have is a disc injury. These are typically caused by flexion, and relatively speaking, they're pretty permanent. Once you damage that disc and you either have a bulge or a herniation, that's pretty permanent. But in saying that, if we look at our middle-aged population, people around the age of 45, 50 to 60% of people have some form of disc injury. The vast majority of those are asymptomatic. That means they've got no pain and no problems. That means it's pretty well managed. Like, it's not a death sentence, it's not a major deal. With smart training and intelligent rehab, you can have your disc be not an issue at all and can be completely functional and pain-free. On the flip side of disc injuries, we have extension-based injuries, things like lumbar stress fractures, pars defects, and spondies. So with your extension injuries, we've got things like stress fractures, pars defects, which is where a stress fracture doesn't heal and you have a floating part of the joint, or floating part of bone, I should say. And you have facet joint overload, which ultimately leads to facet joint irritation. Now, the third type of injury you can have, we have discs and we have extension-based injuries, but the third is just a muscular overload type injury. And that's pretty basic. That one's just strains or any sort of overload where their muscles in the back are doing more work than they really need to be doing for a whole bunch of reasons. The biggest of those reasons is an anterior pelvic tilt. So anterior pelvic tilt, I've already spoken about this before, but it's the leading cause and the driving factor, that lead domino when it comes to both extension-based injuries and muscular overload injuries. The thing with the anterior pelvic tilt though, it doesn't happen on its own. It's caused by a few separate things. Number one is tight hip flexors, like your psoas and your TFL. Now those guys get tight when we sit too much. They get tight and they cause back pain. But when you have back pain, they get tight as well. So it's kind of this vicious cycle. I'll talk about that another time. But tight hip flexors is going to be a big cause of your anterior pelvic tilt and your extension type injuries and your muscular overload injuries. The next cause of that anterior pelvic tilt. Now a weak core, again, sitting. When you get back pain, your core tends to shut off and become inhibited. If you train inappropriately or do the wrong type of core training, that can lead to a reversal in the way your core works. And the other thing that can cause your core to become weak is no training or a lack of training, where the muscles atrophy and they're just allowed to shut down. So that weak core is going to, again, fuel your anterior pelvic tilt. It's going to lead to muscular overload in other muscles, especially your erectors, and it's also going to contribute to your extension-based injuries like the stress fractures and the pars. The other thing with the core is it's also going to contribute to your disc injuries. And it's going to be a factor up there as well. So the next part of the anterior pelvic tilt is weak glutes. Now technically the glutes are part of the core, but they're so important they get their own point. Now again, weak glutes are going to be caused by sitting. An anterior pelvic tilt is going to fuel weak glutes. So that's another one of those vicious cycle type things where you have an anteriorly tilted pelvis, causes weak glutes, causes an anterior compounds. And also a disc injury. A disc injury is going to be a big factor when it comes to your weak glutes as well. Potentially compressing the nerve, potentially causing issues when it comes to neural firing and activation of that muscle. Now, the last thing when it comes to weak glutes is crappy posture and poor movement technique. But that gets its own. So follow me up to here. So if you're a bad mover, those glutes aren't going to get a good chance to work. The same with the core. So crappy movement can be running and walking. It can be slouching. It can be wearing a backpack a lot, or it can be sitting a lot. And so when you have poor posture, or you have poor mechanics and technique patterns when it comes to your movement, that can lead back into all these things. So it's going to create muscular overload. It's going to fuel and drive that anterior pelvic tilt, but it's also going to fuel and drive a tight thoracic spine. And so while, thoracic kyphosis. And so while the anterior pelvic tilt at the bottom is going to pull your pelvis and have it sloping forwards, jamming up your lower back, having a tight thoracic is going to do the same thing from the top. If you're tight through your thoracic and you can't extend or rotate through your rib cage, that's going to pass that energy and those forces down into the lower back and the lumbar spine. Your lower back and your abdominal area, it's supposed to be stable and rigid when we move. If it now has to compensate and create movement for this thoracic spine, which is too tight, that's going to lead to, again, muscular overload, potentially disc injuries, and almost definitely some sort of extension or facet joint-based injury. Does that make sense? So when we talk about lower back injuries, it's a lot more complex than just your lower back is sore, it's a lower back problem. Often there's some sort of a overarching thing, whether it's an anterior pelvic tilt or thoracic kyphosis or poor movement patterns, that's creating and driving the problem that we're seeing. So the back is very much the alarm bell that tells us something else in your system, something else in your kinetic chain is wrong and needs some help and needs some work. So don't blame your lower back injury or your lower back issue on the lower back. It's often bigger. So you have to look for that root cause analysis, that driving factor that's causing the back to be a problem. Now, the last thing I want to talk about when it comes to lower back injuries is this idea of central sensitization. Central sensitization is the concept that